Glenn, don't die from autoerotic asphyxiation. Your friends want to go fishing with you.
This song is from childhood?
Peter, we came as soon as we heard. How is he?
He's in a coma, Lois.
The word coma, it's a very vague term that could mean a lot of different things. Most of the time, what we see is someone's just not waking up, requiring a ventilator or what we call medication-induced coma. So they're sleeping, so that way we can get things done.
Miss Quagmire, your brother Glenn is lucky to be alive. You know, we're all lucky to be alive on such a beautiful day. In fact, nurse, all surgeries are outside today.
You see this big, massive amount of people in the room. Ever since COVID, we don't necessarily let a ton of people in the room like this. It does happen though in different circumstances. If they're coming into the emergency department and have an acute problem, we need to move around and do a lot of testing. So we like 1 or 2 people in the room at max.
Our mother used to sing a song when we were sad. Maybe that'll help now. Glenn, don't die from autoerotic asphyxiation. Your friends want to go fishing with you.
This song is from childhood?
I always tell patients when their loved one is unconscious or intubated that you can talk to them, they potentially can hear you, because when they actually do wake up, they do say that they were aware of the things that were around them.
Where am I? What happened?
Oh, Glenn! Oh, thank God you're all right!
Hey, you touching my girl?
Relax, Jeff. That's your brother.
Yeah, that's how it starts. Come on, Brenda, we gotta get out of here.
The boyfriend behaving the way that he is, if it's disruptive, if you don't feel it's safe, it's a private property, so you can just ask them to leave, and if they choose not to leave and they're trespassing, we could call security within the hospital itself, and then you can always escalate it to the local police department as well. We sometimes have to do that in the emergency department. Oh, he's about to pass out. Diaphoresis, fancy medical term. You have altered hearing. Most people get like tinnitus, and then you get change in vision, double vision, tunnel vision, feeling weak and off balance. You're gonna go down. So please sit down or lay down.
My life is flashing before my eyes.
Oh.
Oh, Peter, I'm so happy you're okay.
Whoa, you're alive?
What happened? Did I have a heart attack?
Heart attack is when a blood vessel supplying blood to your heart is blocked and it's not getting oxygen to that tissue, and then your heart's not beating the way that it should, which leads to cardiac arrest. Cardiac arrest! Which is different than a heart attack.
No, you had a panic attack.
Panic attacks, people will describe impending doom. They feel like they're going to die. We will still do a cardiac workup, EKG, chest x-ray, blood work, and cardiac enzymes to just make sure that it truly isn't related to your heart.
Or in medical terms, a heart attack for wussies.
Oh my gosh, no. You just don't ever say that. You just say you had stress on your body, which then gave you other symptoms, and then the body and the brain worked against you, basically.
You want to mess around on some damp towels next to where the seagulls crap?
It wasn't seagulls. I got locked out of my room earlier.
Oh, why is your poop white?
I don't know. I've been dealing with fecal albinism my whole life.
Wow, fecal albinism. I've never heard of it called that way. There is white poop out there, or poop that is more pale in color, called acolic stool. It has to do with the lack of bile. We see this commonly when people have gallbladder issues, as well as when the gallbladder gets removed, or if there's some issue relating to the digestion in the liver, pancreas, and gallbladder area. Oh, this is why I don't go on cruises.
I've never seen someone eat so many powdered donuts in half an hour before.
Yeah, I was really hungry and I didn't like what they had at dinner.
I think we may have solved your fecal albinism.
White powdered donuts. Could that change the color of your stool? Unlikely.
This is the best night of my life.
Oh no. Stop it. Oh no, poor Meg, poor little man. Just like the decapitation of a guillotine, pretty much instantaneous, not compatible with life. We have a very, very, very small centered something. Could be the airway, could be the bones of the cervical spine, or could be the spinal cord. And then just skin, blood, and soft tissue, aka muscle around the area.
Water skiing?
I don't like getting wet.
Oh, come on. What's the worst that could happen?
Oh, jeez. Oh my gosh, it's like Gremlins. That is hilarious.
Keep them away from water.
Could something like this happen? Maybe sometimes people are allergic to water, and so you can have a reaction to where you get hives. Obviously, if you get scalding water on you, you can get blistering and bubbling of your skin as well. Sometimes you can get infections from salt water. Oh, geez.
Whoa, watch your driving. Is he sleeping? Hey, wake up! Wake up!
Falling asleep at the wheel. If you ever feel this type of sleepiness, please pull over to the side of the road.
Pull over!
Maybe take a nap or call an Uber. It's not worth risking your life or somebody else's life.
What the hell are you talking about? We're about to...
Oh! Baby seat / car seat didn't do its job as Stewie went flying out. No airbags because it's an old car.
What happened?
Where are my knitting needles?
Oh my gosh. Perforated both ears. Will take a very long time to heal. If it goes through the cartilage of your ear, it's not going to heal very quickly. Cartilage has a low amount of blood supply, so it's mostly the tissue around it that needs to heal.
Guys, this is so embarrassing. All this happened because I'm too fat to make it up some stairs.
Peter hanging out at the Drunken Clam with the guys reminds me how quickly those occasional adult beverages can sneak up on you the next day. You may want to consider poor decisions from my company Life Happens to help your body recover faster after a night of questionable choices. Check out Poor Decisions at lifehappens.com or on Amazon.
Peter, you gotta lose weight.
I know. You guys gotta help me, though.
Oh, nice. We got CrossFit. I'm assuming most people watching know what CrossFit is. It's like a cult following.
Welcome to CrossFit, Peter.
How's it different from a regular gym?
Do regular gyms have open garage doors where members' large dogs can charge innocent civilians? Are you ready to see your new Peter?
Oh, there he goes. We see here he's got a lot of extra skin. So this occurs for a couple of reasons. Sometimes with rapid weight loss, your skin doesn't have enough time to retract back. Or if you had significant amount of weight to lose, even though you lost it over a period of time.
What do you guys think?
What people typically end up doing where they have a lot of extra skin, they actually see a plastic surgeon to have the skin removed. Just something to be aware of, especially with people on a lot of the weight loss medications out there. Make sure you're lifting, make sure you're hydrating up, and you're monitoring how quickly you're losing weight.
I don't believe it.
I'm speechless.
Hey, look, it's Jonah Hill sometimes.
CrossFit will help you keep your muscle, will help you burn some extra calories, but the majority of weight loss and body transformation and reshaping is in the kitchen, relating to the foods that we're eating, the volume of foods that we're eating, and the appropriate time of those volumes. Family Guy, so good, really entertaining, a lot of medical components to it, and I know you love it because this is number 31. So continue to send your recommendations my way, and if you enjoyed this, like always, please check out this playlist right here, binge watch everything, and do me a favor, make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.